The Jefferson County Care Transition Coalition is a group of healthcare providers in the county focused on helping people safely move from the hospital, nursing home, or rehab back home. One of the common reasons people are admitted to the hospital and or return, as in readmit, to the hospital is aspiration pneumonia. So our first project was to focus on safe swallowing to prevent this. What we will review is what is dysphagia, steps for safe feeding, red flags for difficulty swallowing, and then special diets and restrictions that people are sent home on. Dysphagia is the medical term that means swallowing difficulty. Someone with dysphagia has a hard time swallowing foods or liquids without having them go down the wrong pipe. The trachea and the esophagus, so your swallowing and your windpipe, are very close to each other. And you can notice in this illustration that the windpipe, the trachea, is much larger than the esophagus. So it is easy for food to slip into the breathing pipe instead of going down into your stomach. These two videos demonstrate swallowing. The first one is a normal swallow, shows how the epiglottis closes the trachea to protect the lungs, and swallowing goes down the esophagus into the stomach. And the second one is a video of a swallow study showing how the food can slip into both the trachea and the esophagus, sometimes without even the patient realizing it. So those two are YouTube videos to give you a demonstration. Some reasons people might have dysphagia is anything that affects the mouth or throat, having a stroke, which affects the muscles, nerve disorders, dementia, Alzheimer's. People with Alzheimer's sometimes just forget how to swallow, the mechanics of swallowing. Loose-fitting dentures or missing teeth can also cause swallowing difficulty. So in a normal swallow, the food is transferred from the mouth to the esophagus in about 2 seconds. A person that doesn't have any problems can complete a meal 30-45 minutes without choking or spilling any food or liquids. If liquids or happen to go down the wrong pipe, that's what people usually, oh, my food went down the wrong pipe. The healthy person is able to produce a very strong cough and get rid of it. The food gets stuck. Normally a person will gag or dislodge the food themselves. So the role of the caregiver who is with the person who's eating is to watch carefully how they swallow. Because you're there when you're feeding them, giving them fluids, giving medication, you're the eyes and ears of the facility, and you have the opportunity to see the client in all these different situations. If somebody is independent, they don't need any supervision, they just maybe set up their food. Dependent feeders are unable to feed themselves, and so they are much more likely to be malnourished, be dehydrated. The staff should be aware of all the techniques and precautions that each feeder requires. If they come home from the hospital with specific lists of what to use, how to feed them. The dependent feeders are the most likely to aspirate. Aspirate meaning the food goes into the lungs, and when that happens over time, they can develop pneumonia. So before the meal, you need to check that the diet is correct, because they are sent home with specifics, pureed or mechanical soft or thickened liquids. And then have the resident sit fully upright, 90 degrees, no leaning back, no slumped forward. They should be wide awake and alert. Dentures should fit well. Hearing aids should be in working order, so that if you're talking to them about what you're about to give them, they can hear you and know what to expect. And then check their individual swallowing recommendations. The care plan comes from the hospital or from a speech therapist or from the physician, and it will tell you what they recommended. And then during the meal, assist with any special utensils or plates. Make sure that if the patient has had a stroke, that you're putting the food in the side of the mouth that's stronger. And then alternate small bites with sips of fluids. Make sure you go very slowly and allow them 5 to 10 seconds per bite. And you might think you're doing that, but try it one time, put a bite in and then count 1,000, 2, 1,000. It's actually a very long time when you have, 5 residents to feed or something. So you have to make sure you slow down and let them chew and swallow. Then watch for the red flags. We'll go over those in a minute. Make sure you sit eye level with the person because you're more coaching them when you feed them. Okay, take a sip. Okay, swallow, chew that a little more. You're more of a coach, and so you want to be eye level. You don't want to be yelling at them from the side of the room or standing overhead. And keep the dining area pleasant and calm, which I think most of your facilities have pretty nice arrangements. After the meal, it's important to check the mouth for holding food. People who aspirate are more likely to get pneumonia if their secretions are not cleared. So if they have a little food or fluid stuck in their cheeks, and then during the day they breathe that into their lungs, they're more likely to get pneumonia. So check after every meal, and then of course brush their teeth, mouth care after every meal, and make sure they sit upright. The red flags for swallowing difficulty is a list of stop and watch for you to place in your facilities on the refrigerator, in the dining room. They can be printed off from this website at any size you need to post. You can even make them into cards to give to family members who are taking their family members out to lunch or dinner so that everybody knows what to watch for this person. So if your resident or family member cannot sit upright, they're slumped, if they are not awake enough to accept food, we've seen it in the hospital where you kind of jiggle a person. Are you awake? Okay, here's your pills. You never want to do that. You want to make sure their eyes are open, they're sitting upright, they know what's happening so that they swallow what you give them. Make sure the dentures are in. If there's any missing teeth, get them to the dentist. Don't let them get distracted. It's not a good idea for most clients to have a lot going on while they're eating. You should focus on the eating. And then if they need to be reminded that there's food in their mouth. So if they are constantly, you put food in their mouth and they're just sitting there, you have to remind them to chew and swallow. That's something to report to your facility manager or their doctor or their families. So watch, and then if that is happening, you just want to stop feeding them. Stop feeding them until those things are corrected. Watching, you want to watch if they start to complain of pain or discomfort when they're eating, like that's difficult for them to swallow whole foods, if something like that it's causing them pain to swallow, or if they don't chew at all. Look to see if pieces of food are falling out of their mouth or there's still food in their mouth after they swallow. So something is not working in that swallowing reflex. If they start to cough or gag, most will have enough strength to cough it out, but you want to encourage your residents to cough. If they start coughing, just, oh yes, good, cough it out, give them encouragement to get it out of their lungs. Then afterwards, if they have a wet, hoarse voice, you need to report those things to your facility manager or whoever's listed on the stop and watch that's on the card. If you give it to a family member, maybe put a name of somebody in the facility that they should talk to after lunch. So what is a dysphagia diet? It's one of different textures of food to help people with chewing and swallowing. And it's usually, the diet is prescribed by a dietitian who does a swallow study. And then when you follow that diet, they're specific for making it easier to chew and move the food around the mouth and therefore reduce the risk of the food going into the windpipe. A level 1 dysphagia diet often will be just called pureed, and pureed foods are pudding-like. They're not jello-like. They need to be smooth with no lumps, chunks, pulp, or seeds. So anything pureed to the smooth setting. So you can puree vegetables to smooth. You can even puree meat to smooth, but you don't want any fiber in there or lumps in there to make it more difficult for them to swallow. Dysphagia 2 is called mechanically altered. These foods are moist, soft textures, ground or minced, small pieces no larger than 1/4 of an inch, or mashed, easy to chew. Sometimes this is referred to as lumpy pureed. And there's another section on this website that will describe these individual diets a little more specifically, and they will include recipes for you. So mechanically altered, you can take a regular meal sometimes and cut it or smooth it or moisten it to be mechanically altered. Level 3 dysphagia is mechanically soft. So these foods are solid soft. So nothing is hard or crunchy or dry. They're easily chewed. So mechanically soft, mechanically altered, phase 2 and 3 are somewhat similar. Liquid consistencies. Your patient might be prescribed for a pureed diet with thin liquids, or a pureed diet with nectar thickened liquids. Liquids with increased thickness to them are more easily swallowed because they can feel them in their mouth. But the amount of thickening also tends to lead to dehydration because they drink less. So the thicker the liquid, the more of it you will need to maintain hydration so that they get enough fluids. And there is a YouTube video on thickened liquids as well on this website. You never want to have hard, crusty, sticky foods on any dysphagia diet. Any client that's having trouble swallowing should never have hard breads, grapes, popcorn, hard candy, nuts. One of the surprising things is peanut butter. You would think it's easy to swallow because it's soft, but it's very sticky and it clumps together, and peanut butter is never on a pureed diet or a mechanical soft diet, or anybody who has trouble swallowing. So this next few slides is helping you decide how to select the right foods. How would you adjust the meal? You have 10 clients and they have 3 different diets. So how would you adjust these meals to comply with the level they're on? So here's your typical breakfast. For someone who is on a pureed diet, you would have to blender the meat, get rid of the orange, probably blender the eggs and the potatoes. This lunch is pretty unacceptable for anything with swallowing difficulty. They can't have the salad or the berries, the hard crusty bread. The only thing they would be able to have would be the soup, so you'd want to adjust their diet accordingly. Spaghetti, if you cut it up into little tiny pieces, is appropriate for mechanically altered diets. For pureed, you would have to blenderize all of that. You don't want to give whole noodles to anyone with difficulty swallowing because they can slip. If they don't have control of the swallow reflex, they can slip down the lungs. This meal can all be pureed or moistened and cut up for someone with the mechanical soft. The broccoli may be difficult. You may want to get rid of that or puree that, because even if you cut that up, it's too hard and crunchy to swallow. Never go out to McDonald's. We know that we like to take our clients out for special treats, but all of that is too difficult to chew and swallow. If you want to do a hamburger, you take it out and you chop it up into very small pieces and add a lot of ketchup or gravy. The French fries would have to be cut up very, very small, a lot of ketchup and gravy. None of that is very nutritional, but they could actually be able to swallow it. And then in terms of the drink, make sure there's not a straw restriction on their diet. Many people with swallowing difficulties have straw restrictions as well. Of course, we want to give all of our clients treats for special occasions. The pie is fine without the crust. The crust is too hard to swallow. The cookie, if it's soft, a soft chocolate chip cookie, that would be fine. Cut it up, add a lot of milk. You can either cut up for a mechanical soft or pureed, blenderize for a pureed diet. Ice cream is always fine without the cone. You'd want to serve it in a dish. And Jell-O is never fine because it slides, it slips. These are some resources you can go to understand dysphagia diets, or if you are looking up a specific type of diet, pureed or mechanically altered, there's more description of those too, and also liquid consistencies. So you can see exactly how to thicken coffee, juice, water. You can thicken just about anything, and you just follow the directions on your thickener, but this video will show you what it's supposed to look like. In addition, the ARDC website does have 2 or 3 more modules about these diets and about additional information about choking and what to do about choking. And you can always call the ADRC or the hospital for more information on aspiration pneumonia and how to prevent it.